Today, we're talking about breast cancer. I'm going to give you an overview of this incredibly important topic. We're going to go through the trends in breast cancer. We're going to talk about the risk factors in breast cancer. And towards the end, we're going to introduce a breast cancer calculator. I'm going to show you how we can use that. And of course, a case example that outlines all the risk factors and gets us ready for a deep dive into breast cancer. Let's go. Welcome back to Citizen Surgeon. I'm Dr. Erik Pearson, and today we're talking about breast cancer. Now, this is the first of several videos where we're going to dive deep into the subject because it is such an important cancer to understand, not only for medical students and residents, but for everybody. So if you're not a medical student or you're not a resident, you're just somebody out there interested in breast cancer, I think you're going to find a ton of value in this video. We're going to start out by going through the epidemiology, going to tell you some statistics on breast cancer, how common it is. I'm also going to go through all of the risk factors. We're going to talk about age, of course, gender, ethnicity, and some other important risk factors. I'm going to show you a breast cancer calculator based on the Gale model that's easy to access. Anybody can check it out. And then we're going to go through a clinical case, so stick around for that. If you like this content, subscribe, turn on the notifications, share it with your friend, lets me know that I'm providing value. And of course, if you have any questions about what we're talking about today, leave it in the comments below. I love engaging with you guys. So let's get into it. Breast cancer. To understand breast cancer, first we got to understand the anatomy of the breast. Now, breasts are located on the chest, and they are in both women and in men, okay? And they have milk-producing glands. We call those glands lobules. Now, the milk and other substances that's produced there travels down into the ducts and then is excreted through the nipple. Now, there are Cooper's suspensory ligaments. There's also fatty tissue. There's the areola, Montgomery's tubercles, a lot of other things with the breast, nerves, lymphatics, but I wanted to just focus on the lobules and the ducts. And in future videos, we may go a little bit deeper, okay, especially those videos when we're talking about surgery for breast cancer. But if we understand what the lobules are and what the ducts are, then it becomes easier to understand breast cancer because the vast majority of breast cancer is from the ductal epithelium, okay? And that is ductal carcinoma. And that starts out as ductal carcinoma in situ. And that's about 80% of breast cancer. You can also have breast cancer that's in the lobule, and we call that lobular carcinoma of the breast. And that's about 10 to 15% of breast cancers. Now, how common is breast cancer? Well, in 2024, what are we going to find? Well, in 2024, we're going to find 313,000 new diagnoses of breast cancer. We're also going to find over 42,000 deaths related to breast cancer. So those are some really big numbers. And those numbers contribute to the fact that breast cancer is the most common malignancy in females in the United States. Females have an increased risk of breast cancer compared to males. And so over the course of a lifetime, that risk is about 1 in 8. Okay. And what is the breast cancer risk in a male over a lifetime? Now, this isn't taking into account BRCA1 and 2 mutations. We're going to talk about those. But if we just took the average male, that risk of breast cancer is 1 in 1,000. So you can see this is much more common in females, and of course, the most common malignancy in females in the United States. Well, what has this looked like over time? Now, if we look between the 1970s and the 1990s, we saw a dramatic increase in the incidence of breast cancer, their number of new diagnoses every year. Now, a lot of that was due to increased surveillance programs and increased awareness and knowledge of breast cancer and what to look for, okay? Now, why was there that dramatic decrease in the 1990s and then it's remained kind of stable since that time? Well, the answer there is the Women's Healthcare Initiative study came out showing that hormone replacement therapy had a small but significant increased risk of breast cancer. And so one component is decreased use of HRT led to this decrease in the incidence of breast cancer. And since the 1990s, we've had pretty stable incidence. Now, how about mortality or death from breast cancer looking back to the 1970s? Well, we can see that the incidence of death due to breast cancer per 100,000 women was 31, 32 in the 1970s and 80s, and that has decreased to about 19 in the current era, 2020. Now, there are multiple reasons for this. Detecting breast cancer at an early stage because of increased surveillance, increased knowledge and awareness, and of course, improved therapies for breast cancer, not only on the surgical front, but with radiotherapy and also chemotherapy and hormone therapy. And we're going to talk about all those in future videos. So definitely keep watching this series if you want a deep understanding of breast cancer. Now that we have a good understanding of the trends, it's important to think about risk. Well, being female is probably the greatest risk of getting breast cancer. Well, what's next? Well, that is age. So when we look at age, and I broke this up into decades, so between the 20 to 29, all the way up to 70 to 79 years old. And what do we see? Well, the number of new diagnoses per 100,000 women in that first decade, let's say 20 to 29, is only about 1.4 cases. So it's very rare in young women. But as women age, that risk goes up. And we can see quite a dramatic increase in the number of new diagnoses in women over 60 years old. So age is a really important risk factor when it comes to breast cancer. Now I have this snowflake up there, or maybe an asterisk, all right, you choose, but it has a few numbers here, all right? And so what is this getting at? And here we're going to be looking at ethnicity. And so these are the number of new breast cancer diagnoses in a particular ethnicity per 100,000 women. And what do we see? Well, the highest risk ethnicity are white women. All right. And so here we get about 128 new cases. Black women have the next most common number of new cases at 124. And then it drops down for Hispanic women, followed by Native American women, and finally Asian women with the lowest risk. Now, another thing that's important in breast cancer with ethnicity is there's a distribution of the different types of cancers found in different ethnicities. So, for example, Black women have a higher incidence of triple negative breast cancer. That type of breast cancer is more aggressive, has a worse prognosis, and is very important to detect early. And we're going to talk about that a little bit in that case example at the end of the video. So let's take a deeper dive into risk. Now you can see I have a table here. Each of these rectangles has a title of a risk factor. And behind that title is an odds ratio that's going to give us the multiple of risk for that individual factor. So we talked about age. Let's take a 60 to 69-year-old versus a 30 to 39-year-old. What's that odds ratio of risk for breast cancer? Well, that is about 10. So 10 times the risk. What if we look at BRCA1? So BRCA1, that's a genetic mutation that increases the risk of breast cancer, and that is 10 to 30-fold. And in a future video, when we talk about BRCA1, BRCA2, we talk about the genetics of breast cancer, I'm going to take a deep dive into that, but a 10 to 30 risk. How about BRCA2? Well, that risk is 5 to 20, so a big range with this genetic predisposition to breast cancer. Now, it's important to say when we're talking about genes in breast cancer that the vast majority of breast cancer is sporadic, say 90 to 95%. And a small percentage is inherited due mainly to BRCA1 and BRCA2. And again, we're going to talk about that in future videos. Family history is an important risk factor. If we have a first-degree relative and just one of them with a history of breast cancer, the odds ratio is 2 to 4. If we have two first-degree relatives The odds ratio increases to 4 to 6 times the risk of breast cancer. A personal history of breast cancer also increases the risk by 3 to 4x. And there are multiple other risk factors that increase the risk of breast cancer modestly. Now, these are most likely additive. Remember, nothing in medicine happens in a vacuum. Everything happens together. So if we have multiple risk factors, our risk is going to increase. So the risk of being on hormone replacement therapy is about 1.3. The risk of breast cancer is increased with late menopause, so increased time or exposure to estrogen, and that risk is 1.5. The risk of having an early menarche, so starting menses before the age of 12 years old, again, a longer exposure to estrogen, and that risk is 1.2. Nulliparity, or having that first child over the age of 30, also increases the risk of breast cancer. And other risk factors include radiation exposure, alcohol use, obesity, and having dense breast tissue, which makes it more difficult to detect early breast cancer. So now that we have a good understanding of risk, we have to think about risk assessment. So how do we put all of these risk factors together? Well, there are a lot of different tools. We have the Gale model that incorporates several risk factors. We have the breast cancer risk assessment tool. I'm going to take you through that tool in just a couple of minutes. There's also the IBIS breast cancer risk evaluation tool. There's MammoPrint and Oncotype DX. Those are genetic studies that actually look at a breast cancer and assess risk. Then, of course, there's the Breast Cancer Surveillance Consortium Risk Calculator, and that's another tool to evaluate risk. So, like I said, we're going to look at the breast cancer risk assessment tool, but before that, let's jump into a clinical case, and then we're going to take some of the risk factors and look up that patient. So let's take a look at this clinical case. We have a 52-year-old African-American female who presents to clinic. On self-examination, she discovered a lump in the upper outer quadrant of her right breast. Now, taking a deeper history, we find out that her mother died of breast cancer at the age of 60. Our patient, Lisa, has been on hormone replacement therapy. She had her first child at the age of 35. She has modest alcohol intake at 2 to 4 drinks per week. Her BMI is 32, and she has limited physical exercise, mostly at work. So, how do we assess the risk for Lisa, our patient here? Well, let's check out the breast cancer risk evaluation tool. And this is easy to find. I'll put a link to it in the description below. So when you look at the tool, you can calculate patient risk. And here, do we have a history of breast cancer? No. Do we have a mutation? That's unknown. What's the patient age? We're going to select 52 years old, and then we're going to choose our patient's race or ethnicity at African American. We're going to look down and has the patient ever had a biopsy with a benign diagnosis? No. What was the age at the time of her first menstrual period? So that was 7 to 11. What was the woman's age when they gave birth to their first child? 35 years old. And then, of course, do we have any first-degree relatives? And she had one. So we look at the 5-year risk of developing breast cancer and the lifetime risk of developing breast cancer. And you can see that it's quite small, but she presents with a mass. So our suspicion for breast cancer is really high despite these relatively low numbers. So the breast cancer risk assessment tool takes in some of these major risk factors, but it leaves out some of the other things we talked about, like hormone replacement therapy or alcohol use or increased BMI or limited physical activity. Now, whether or not the risk is high or low on the risk calculator, we still have to take a good history, take all of the risk factors into account, do a complete physical exam, do a mammography, ultrasound, MRI if it's indicated. We're going to talk about that in future videos, and make the diagnosis. So that tool can be helpful. Check that out. The calculator is in the description below. I hope you enjoyed that today. We talked about the risk of breast cancer. We talked about the trends in breast cancer, and we talked a little bit about the anatomy. Basically, what is ductal carcinoma, what is lobular carcinoma. Then we introduce terms like BRCA1, BRCA2, and triple negative, which we're going to talk about in the next video. So if you like this, give it a like, give it a share, leave a comment below. Also, check out CitizenSurgeon.com. It's a website. I have a lot of valuable information on there. As always, stay safe, study hard. I'll see you next time.